oftentimes we know that children do not want to be seen as different than their peers. So because of that, they don't want their friends to know that they have arthritis. They oftentimes don't want their teachers to know. Certainly as they become adolescents, the number one thing is being part of that peer group. So having them know that they have arthritis can be a tremendous challenge.
Up to 40% of kids don't want their classmates or other people to school, like their teachers, to know that they have a disease. And so one of the things that you need to do is truly respect their need for privacy, even if it causes them extra burden, extra discomfort. I think it's very important that you recognize that kids oftentimes don't feel comfortable about that. So you work at that not by overriding their privacy at school, but working at other issues that contribute to why kids don't feel comfortable talking about their disease.
It's normal that kids do not want their peers to know, but really having that conversation, talking with the child, and what is that an indicator of? Is it an indicator of their poor self-esteem or not feeling good about things? Or are they just scared that they'll lose friends because of this? I would guess that parents feel like they have to walk a fine line between respecting their child's privacy, but yet advocating for their child's needs at school. And so it can be a fine line in how do I do that. I think an open, honest communication in terms of also explaining to the child, is there one person we could talk with?
As soon as kids get comfortable with opening up to somebody, then it's very freeing for the child, but they oftentimes can't understand that. So you talk to them about why it's hard to talk about their disease, why they want to keep it quiet, and try to understand it from their perspective and try to address some of those issues. So is there a way you can engage a healthcare provider in helping the child become more open about their disease? And there certainly is. I think it's perfectly legitimate for parents to call a member of the healthcare team before the visit or send an email or other means of communication to give them a heads up as this is an important issue. And healthcare providers can have influence with children in ways that it's hard for parents to do. Many children respect their healthcare providers. They come to know them over the years if it's a chronic disease, and so they're sometimes willing to take risk if they are instructed to try it by their healthcare provider that the parent would have said the same thing, but if the healthcare provider talks about it, it may have more import.